Hey guys, it's Crystal from livingwithgastroparesis.com, and it's FAQ Friday. So this week we're going to talk about a topic that, a lot of people don't really like to talk about, but it's very relevant to those of us with gastroparesis, and that is constipation. And so a lot of people with gastroparesis will experience constipation, and there's usually some concern as to what the cause is, and then of course there's always a question about what to do about it. So I just did almost an hour-long bonus class for my group program all about constipation. So there's way more to talk about than I can talk about in a FAQ Friday video. But what I'm going to do is give you guys some common reasons why people with gastroparesis experience constipation. And then I'll give you just briefly some tips to help you alleviate the constipation, diet and lifestyle tips. Okay, so why do people with gastroparesis tend to have constipation? Well, there are a number of factors that, in my opinion, based on my work with clients and in my personal experience, that play a role in most cases. So the most common reasons why people are experiencing constipation is probably a number of factors all happening at the same time. And that includes insufficient fluid intake, so dehydration. Even mild dehydration over time can lead to constipation. And a lot of people with gastroparesis, because they feel full very quickly, or they're trying to maximize their calories that they intake each day, they're not drinking enough water and other non-caffeinated fluids. So they might be drinking soda, for example. It's really important that you're getting an adequate amount of water or other non-caffeinated liquids to lubricate the stools, basically, okay? Your colon needs a sufficient amount of fluid in order to regulate your bowel movements. So for a lot of people, the lack of fluid is a big factor. What I would recommend is that you keep a water bottle with you, and you literally just sip it all day long. Especially if you find that drinking a glass of water or drinking with your meals, if that fills you up or exacerbates your symptoms, you'd be surprised how much water you can drink throughout the course of the day if you just sip on it consistently all day long. So find yourself a water bottle and keep it with you. And that's the first tip and the first cause. Okay, secondly, a improperly balanced GP-friendly diet can certainly lead to constipation. And the GP-friendly diet in general is low in fiber, but a lot of people are going a little too low in fiber. So if you're not sure exactly what to do, go back and watch last week's FAQ Friday video where we reviewed the 10 principles of eating for gastroparesis. And of course, check out Eating for Gastroparesis, my book, which talks all about that. But if you're eating too little fiber, or you're eating too little fat, or you're eating mostly refined, processed foods that are completely empty and void of nutrients, it's very likely that that's contributing to your constipation. And it's not just the fiber content itself necessarily. So a lot of people think, well, of course I'm going to be constipated because I can't eat 25 or 30 grams of fiber a day. Unfortunately, though that is the recommendation, the average American is eating about half of that. So the average American is eating about what's recommended for a GP-friendly diet. So you're not that far off from everyone else, unfortunately, but what you really need to do is focus on maximizing the nutrition in the diet. So again, go back and check out the dietary video from last week, check out the Eating for Gastroparesis ebook, but start to really replace some of the empty foods in your diet with GP-friendly fruits and veggies, up to that kind of 15 grams of fiber limit. And that's where you'll start noticing some difference. Of course, you want to do everything very slowly, especially when you're increasing fiber. When you increase fiber, you must increase your fluid intake, okay? So the first two things that we talked about, they go hand in hand. If you try to increase the fiber in your diet, even within that range, that 10 to 15 gram range, and you don't increase the fluid in your diet, and you don't increase that fiber very slowly, you'll most likely notice an exacerbation in your symptoms. So you want to do it slowly, and you want to make sure that you're drinking enough water along the way. Lack of physical activity. This is another one that a lot of people, when they have gastroparesis, they stop being physically active, either because they don't feel well or because they're trying to maintain their weight and they're afraid that physical activity will contribute to weight loss. You guys probably know I'm a huge proponent of physical activity for gastroparesis management. It makes a difference. I know that personally. I know that from working with tons and tons of clients. I know that from what you guys have said on my Facebook page. Physical activity makes a difference in gastroparesis management. It's also important for bowel regularity. So try to get 30 minutes of physical activity a day. It doesn't have to be strenuous. In fact, it shouldn't be strenuous. Mild to moderate physical activity for gastroparesis management. That will also help your constipation. A lot of people with gastroparesis are on medications that can actually cause or contribute to constipation as well, and this is something we might not think about. But if you are on medications, especially if you're on antiemetics like Zofran, if you're taking antidepressants, if you're taking antispasmodics, those are sometimes prescribed if you have IBS in addition to gastroparesis. Those can all contribute to constipation. Certainly narcotic pain meds, if you're on narcotic pain medications, those are known to cause constipation. So if you're on these meds and you're having difficulty with constipation, you want to talk with your doctor and make sure your doctor is aware that you're experiencing the side effects of those medications in terms of constipation. You want to talk with your doctor about what you can do to alleviate that. There are some over-the-counter things that doctors often recommend, things like Miralax to help offset the constipating effects of some of those medications. But it's important to be aware that many of the medications that some gastroparesis patients are on can contribute to constipation. So in my experience, those are the most common reasons that people tend to be constipated with gastroparesis. There are some other reasons, but these are less common. So things like underlying conditions. If you have hypothyroidism, for example, that can contribute to both constipation and gastroparesis. Underlying conditions like scleroderma or lupus, those can also cause constipation. So for some people who have an underlying condition, certainly that's contributing to the constipation as well. In some cases, there is a diffuse motility disorder, so it's not just the stomach that's slow, it's also the small intestine and the colon. That's less common than the other things that we just talked about, okay? And lastly, some people have what's called pelvic floor dysfunction. And so this means that the muscles in the pelvic floor, the muscles that control basically what happens when you have a bowel movement, they are not working properly. So you can go through a biofeedback program to address that. There's specific testing that addresses that. And this is all stuff, by the way, that I get into more in depth in my new book. So if this is something that you're interested in, definitely make sure you're on the mailing list for the new book because you'll get more information when that comes out. So those are really my tips. I want you guys to drink more water. I want you to take a look at your diet and make sure you're maximizing the nutrition in it. Go back and check out last week's video, read Eating for Gastroparesis. Make sure you're getting at least 20 to 30 minutes of physical activity a day. You also want to make your bowel movement part of your routine, okay? So you don't want to ever ignore the urge when you get it, okay? If you feel like you need to go to the bathroom, go. Don't ignore the urge and think it'll come back again later. And try to make it part of your routine so that every morning you're at least trying to have a bowel movement and you know, see what happens once you incorporate these other lifestyle modifications. One note about supplementation, magnesium is sometimes really helpful for constipation. Magnesium has natural laxative properties, so you can take a magnesium supplement sometimes, and that will help with constipation. Usually the recommended dosage is around 400 milligrams a day, so that's something you can look into, something you can ask your doctor about, certainly. But the important thing to remember is that for the most part, most people who are dealing with constipation issues related to gastroparesis, it's kind of a combination of the things that we talked about in this video. If those things don't work, so if you are drinking a lot more water, if you've incorporated more GP-friendly fruits and veggies in your diet, you know, you're getting physical activity, you're not on any medications that cause constipation, then you certainly want to talk with your doctor about the constipation. There are other tests that can be done to determine the cause. If there is some kind of slow motility in the lower half of the GI tract, or if you do have pelvic floor dysfunction. So if constipation is an ongoing concern, you should definitely talk to your doctor. If your bowel movements change at any time, always let your doctor know. That's an important thing for them to address. So I hope this was helpful. And as always, I welcome you to my Facebook page, facebook.com/livingwithgastroparesis, where we can talk more about this. And if you are not on my mailing list, you can sign up on my Facebook page, or you can sign up at livingwithgastroparesis.com. You'll get my monthly newsletter. The October newsletter is going out next week, so make sure you're on the list. And you will also be notified when the new book, Living Well with Gastroparesis, is released. So thanks for joining me, and I will see you next week for another FAQ Friday.